Hi, my name is By R.Soyal. I will be presenting contemporary issues. Contemporary issues in the health and social care sector refer to topics that are current or occurring situations which affects places and peoples due to the issues which remain unresolved. In this presentation, contemporary issues have been identified in the nurses' departments, and furthermore, the effects they have on the service improvements have been explored. During the COVID-19, the nurses faced new and extreme contemporary issues which also carried on throughout the leaving of Brexit. The media, as one of the stakeholders of the National Health Services, had an influence on the contemporary issues. They reported positive and negative news, which had the effect on the service improvements. Lastly, in my presentation, I hypothesized recommendations that could possibly have a positive impact on the contemporary issues identified. Moving to LO1, slide 4. Nurses are very important. No healthcare setting will be able to function without them. They have many responsibilities that they carry out. Some of these include updating patient records. They do this to keep full, clear and accurate information to share with relevant professionals. They assist procedures to help reduce risk of infection for patients staying in the hospitals. They observe patients, they collect data which provides information about the patient's condition. They operate many medical equipments, and they also conduct examinations to gather information for updates on the patient's condition. Alongside with all the responsibilities, nurses face contemporary issues every day of their working lives. The main one, I believe, is insufficient number of staff. Nurses will work longer hours, which may affect how they deliver their work. Due to not resting enough, the nurses will also be putting their health at risk. Feeling tired and not getting enough rest will lead to ongoing back pains, feet pains. These could lead to taking time off work, which will then result in the staff numbers getting lower than already is. Also, workplace hazards. Nurses that work with equipment and tools that may cause danger and hazards are at risk. Having a full load may lead the nurse to be less careful with hazards around them. So if the nurses are feeling extremely tired and covering staff shortages may make them less aware of hazards. For example, if the floor is wet and they're rushing to get to the other patient and they might not realise that spillage is there, they may end up slipping and hurting themselves. Also, nurses face discrimination. Discrimination is a very important one, as nurses face lack of respect from patients, co-workers, administrators, and even doctors. Negative attitudes towards the nurses will affect their passion towards their job. Discrimination may even lead the nurses to question themselves if they are in the right job for themselves. Even exposure to diseases, they face that every day as well, as they work very closely with patients. They should always wear personal protective equipment, PPE, to make sure that they are minimizing these risks, so it does not lead to affect the service improvements, because being exposed could also lead to taking time off work. Moving on to slide 5. Nurses in the pandemic, the COVID-19 pandemic, has faced new and extreme contemporary issues. COVID-19 critically impacted the whole of healthcare. There was already a serious shortage of nurses. The nurses faced so many challenges during the pandemic. They experienced feeling drained of energy throughout the pandemic. Physical and psychological distress was forced onto the nurses fighting against the COVID on the front line. Their psychological distresses was described as sleep disturbance, symptoms of anxiety and depression, post-traumatic stress, and they even found making decisions very hard. The nurses were left to feel vulnerable due to global failure of supplying personal protective equipment. Nurses also face different kind of contemporary issues within the exit of the EU. The contemporary issues during and after Brexit. Brexit had a big impact on the NHS, and it was warned by many organisations that leaving the EU could affect the NHS to function without their international workforces. All the contemporary issues that came up during the Brexit are still currently ongoing. Like, for example, a large number of nurses left the UK health and care workforce who was employed from the European Economic Area. Also, many nurses leaving the UK has increased demand for nurses. International recruitment was a solution for the NHS, and they used this method to cover the staff shortage. But according to King's Fund, international recruitment was a solution to expand the staff headcount. It was used as temporary before the exit of the EU, but could have been a permanent solution if we were to stay in the EU. And even medical products and medications are now being delayed due to more checks and paperwork are needed at the ports before the products and medicines are allowed to come into the UK. And this will affect service improvements, as it will just delay the services. Moving on to LO2, slide 7. Media has an important role as a stakeholder. Their role is to inform public about information that may affect them. The media also has a role of safeguarding the NHS's reputation. During the pandemic and Brexit, there was positive and negative impacts. Positive impacts was that they promoted nurses and educated the public, and which showed respect for nurses in their own departments. And also, nurses could have used the platform to promote themselves using social media to leave positive impact on the public. Throughout the COVID-19 and Brexit, the media played a big part on the influence of the nurses and contemporary issues. Some of the negative impacts was mainly with social media, is according to the World Health Organization, social media and most digital platforms spread invalid and misleading information. The World Health Organization expressed themselves in a very angry way. The World Health Organization also stated that it has been proven that social media and other digital platforms were spreading threat to the public as much as the virus was. This led to skepticism and fear. The public was affected by all negative posts and stories, which was also affecting the public's mental health. Some of the headlines that was reported by the media was, for example, the Nursing Times magazine put a survey together, and it specified that 80% of the nurses felt that patient safety was compromised due to the critical shortage of staff. BBC News reported that retired practice nurses and doctors, including other retired healthcare workers, has offered to return back to the NHS to support present staff. Another one is the Guardian newspaper reported that the hospitals were encouraged to discharge their patients due to lack of bed capacity and staff shortages. You see, it depends like where you look at these headlines from, but it could have a positive and a negative impact on the service improvements. In moving to LO3, slide 9, the contemporary issues that have been identified throughout our presentation was staff shortages, scheduled treatments, getting delayed diagnoses, underfunding of staff, and a few more. I have recommended a few things where, for example, to help with the staff shortages, cross-training staff may help, because cross-training staff will enable flexibility, and other staff can fill in their colleagues in different departments, because with this it will be great motivation for them, as they will be learning new skills, and this will also lead to promoting internal hiring within the healthcare. Also, offering flexible scheduling options to the workers, where they can choose hours when they can do, and so they're not doing overload work. Promoting accessible healthcare information. Health education will encourage people to learn new skills and have more knowledge on health issues. This will give people the opportunity to be able to go to a pharmacy or try home remedies before making their way to the GP or the accident and emergency department. This will both benefit healthcare and the patients, as they will be saving time and getting treatment faster. Also, aftercare for early discharged patients. All patients that get discharged early should have regular checkups on a community healthcare workers, and these could even be a phone call to see how they're feeling, or patients that got discharged after surgery, a community nurse can visit for a few days and make sure that their wound is clean and dry, and to avoid infections. And this will give more space in the hospitals. And also using staff agencies to cover staff shortages is a great way to try and balance it out, and also just to apply for more funding for the NHS. The government should show priority and observe the issues to the NHS and give appropriate funding to be to give the patients more beds, more equipment, medication, and funding is important because we need more healthcare workers. In conclusion to my presentation, healthcare sector was hit by the pandemic and Brexit in quite a harsh way, and nurses departments got affected really severely because their staff shortages dropped by very big numbers. The recommendations that have been made will be great if they were observed, because with funding and more staff, everything could be back on track, and there will be less cancellations, less delays, and you know, even taking these little steps will make the NHS just get back on track. Thank you very much.